Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, our topic is sexual violence as a weapon of war, with a focus on reports about the Hamas attacks of October 7th in Israel. Professor Nancy Glass of the Johns Hopkins School of Nursing has studied the trauma of violence against women and girls in conflict in countries around the world. She speaks with Dr. Josh Sharfstein about the themes that have emerged in this work and how they inform her reaction to reports from Israel. This podcast was recorded several weeks ago. Earlier this week, the United Nations announced it was sending a team to Israel to investigate reports. Please note that this is a difficult conversation that discusses sexual violence, including rape. And please listen with care.
Professor Nancy Glass, thank you so much for joining me today on Public Health on Call to talk about a very difficult and important topic, which is sexual violence as a weapon of war. Would you be able to start by introducing yourself to our audience?
Yes, thank you for having me, Josh. I'm Nancy Glass. I'm a professor at the Johns Hopkins School of Nursing with appointments at the School of Public Health and School of Medicine. My area of research and clinical practice is the prevention and response to violence against women and girls globally, and with a specific focus on humanitarian settings, including conflict and post-conflict settings.
So you are an expert in the prevention and response to violence against women and girls during and after conflict. Can you share where you have done this work?
I've spent a lot of my career in the eastern part of the Democratic Republic of Congo, where they've had the ongoing conflict for almost 30 years, and focused a lot of my research and still conducting research with families, women and their families who have experienced displacement related to the conflict, but also have had the experience of being sexually assaulted by militia members and combatants as a strategy. When we say as a weapon of war, as a strategy to move people off the land, to insert fear in the family, to bring shame on the family. This is a war of territory, where in the eastern region of Congo, like we've heard, there's a lot of resources from gold to coltan. So moving people off their land and fear through sexual violence is very effective.
And what is the nature of your research? What are you studying when you're talking to families?
Well, when I first started doing this work, I would talk with women about their experiences, mostly from a health perspective. What were their health needs? As a clinician, as a nurse, I went in to talk to them about reproductive health and their physical health and their mental health, but quickly found out that they were very concerned about the stigma that they were experiencing in their community, how that impacted their relationship with their husbands or their partners, with their other family members and communities, and how that then affected their economic stability. So we started to work with local organizations to develop programs that provide economic support for women and their families, but also making sure that they're getting mental health services, but also working with the husband and the wife about sexual violence and about how this was not something that she could have prevented, and also that it wasn't his fault. Many of the husbands felt guilty for not protecting their wife or their children. So there's a lot of guilt and shame. And so we've been working over the years to try to address those issues.
Thank you. And you've worked in other parts of the world as well?
Yeah, so Somalia for the last 10 years, working on actually addressing social norms in communities that really sustain sexual violence and other forms of violence. One of those norms is when you're in conflict, sexual violence is going to happen and there's nothing we can do to prevent that. Some of this comes down to training police having accountability for militaries. I mean, I know it sounds challenging, and it is, but I think we have to take on the notion of we can prevent this. There is a way to stop. This is not something that has to happen in war.
Understood. Beyond the Democratic Republic of Congo and Somalia, any other work that you've done that you would like to mention?
Yes, I've been fortunate to work in Colombia as well as Haiti, some with UNFPA in the Northwest Syria, for example, and Ethiopia. Those would be areas that South Sudan. I'm sorry, South Sudan as well.
That is a tremendous geographic range on this topic. And I wonder whether there are certain themes that have become apparent to you as you're looking at sexual violence in conflict in different parts of the world.
I think there are themes, and I think they come at multiple levels. I think there's the individual level where the woman, the survivor, or the family of the woman who was sexually assaulted, they want their family member, or they want to be provided with services and support from the community. They want to have justice. They want to be able to tell their story, but tell their story in a way that is respected and confidential, so that they want to be able to give evidence. They hope that someday there will be justice. I think at a community level, there is a lot of themes around not protecting the community members, not having the resources to provide the services that are needed, not knowing how to collect the evidence, and not feeling supported by the government or the larger community in providing safety. I think there is a belief by the perpetrators of the violence that there is impunity, that their leadership, be it military, militia, police, will not hold them accountable, and that it is the spoils of war, that it is something that comes with being the victim. It is a way to show their superiority, and there's nothing that can stop them, and to bring fear in the community.
In addition to spreading fear, is causing shame a goal of those who use sexual violence as a weapon of war?
Oh, absolutely. I think the perpetrators of sexual violence in the context of war know very well that their assault on women in a community brings shame to the woman, brings shame to the family and the larger community. And I think that drives them.
Now, as someone who has worked in this area, you undoubtedly have seen and thought about the absolutely horrifying reports of sexual violence that are coming from Israel, the attack on October 7th. I have to say, these reports, which involve not just sexual violence, but also torture, murder simultaneously, are beyond, what I think most people can even comprehend. It's unbelievably difficult to read, let alone contemplate. I wonder how you look at this, how you read a report like that, given your background. What do you see?
What I see is a horrific, it's hard to put words, I think, on what I read from the witnesses and from the accounts. I think it's unbelievable that a human being could do it to this type of violence and torture to another human being. So I do think it's very hard for people to understand how this happens, how somebody could have so much hate for another person and feel justified and feel like they have a right to torture, mutilate, and rape somebody, and then murder them as well. And so I think that's the question we all have in this instance in Israel on October 7th, and when we see this in other conflicts.
I'd like to ask you a question that I had when reading some of these accounts because of just their absolute horror, which is whether they struck you as unprecedented or whether this is something that happens in our world and we just don't read about.
I'm sorry to say that it's not unprecedented. I mean, this is something that happens in conflict, and we often do not read about it. I think that Also, I think one of the things that was a bit different in the New York Times article is the witnesses and their description, their ability to really give the details of what happened. That to me doesn't often happen. And so I think that when I read it was so profound. What did they have the courage to tell that story and what that must have been like for them, the fear, the helplessness, not being able to help, maybe someone they loved and cared for. I couldn't imagine that.
You've spoken about how there is often a lack of accountability for sexual violence in war. Are you concerned about accountability for the sexual violence in Israel?
I'm deeply worried that there will be no accountability. And I don't think that's unique to the situation in Israel. I think it's a global challenge. But I think as I read the reports from Israel, I think that within the trauma and chaos for a community, a lot of evidence was lost, a lot of documentation of what happened will be harder to get. You know, I deeply understand why families don't, just imagining your family member going through this and then being there, you want to grab your family, you want to take care of them, you want to be able to bury them with dignity. But we've also lost our opportunity in some cases to document the assaults and the violence and the torture. That's going to make it hard and I think the people who do this know that. They know that. They know they're creating so much shame and distress that families aren't going to demand for investigation in the way that could maybe hold people accountable. We have to, as a community, as a world community, demand the UN, demand the International Criminal Courts, take this on and review what we know, talk to these witnesses, talk to family members, try to talk to survivors. It's going to be very hard to talk to survivors because they're very afraid. They want confidentiality. They're afraid about retaliation. They're afraid about many things, and they've been terribly traumatized. So I think we have to do it very carefully. But I think we have to hold ourselves accountable to this. As I would say, in the Congo, in Somalia, in any of these countries, we have to do better in holding these perpetrators accountable.
Professor Glass, you are a nurse, you're a professor at a school of nursing. You talked about how a lot of the work you've done is about helping people recover or respond to these absolutely catastrophic moments in their lives. What do you think can make a difference for people who have witnessed or survived these events in Israel?
I think Israel is probably in a better situation than many countries, to be honest, because of the highly skilled professionals and the infrastructure that exists in healthcare and mental health care. I think that, and I trust that the professionals there are really trying to build the system and support for survivors and witnesses, and that they're providing them with the opportunity to move forward on their pace with healing and seeking justice. None of this happens overnight. People are processing and they need time.
What kinds of services are helpful to people around the people who experience this? The family members, children, and others.
That's what we don't. I'm not familiar with the system in Israel, but I know in the U.S. we don't do that well. We don't do a lot of grief counseling, allowing people to the place to be with others that have lost family members in a similar way. There are some programs. I think we have to recognize that some of the children might have witnessed this. Their family members may have witnessed this. So I do think that they need to be given opportunity for counseling, for professional support, be it individual or group care. And I think that people will offering those services, surrounding those people with support and love, but also allowing them to be more than the sexual assault or witnessing that, to try to get back to their lives, I think is very important.
Professor Nancy Glass, this is an incredibly difficult conversation. I thank you so much for spending all this time with me and our listeners to talk about sexual violence as a weapon of war. And I wish you the best with all of your work. I also hope very much that it isn't needed and that these kinds of absolutely horrible atrocities that we've been talking about are relegated to history as soon as possible.
Thank you, Josh. Thanks for having the conversation.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.